Recording in progress.
Good morning, Kim. Can you hear me? I think your mic is mute. Okay.
Hi, how are you?
Good. Well, good morning. I see you and hear you clearly. All right, we're probably gonna get started now. So I'm gonna have Donna gonna comes up and do the
Okay.
intro, and then she's gonna pass it on to you. Okay.
Okay.
We're gonna start.
Hello and welcome to today's webinar with eLotus, the leading provider of acupuncture continuing education. I'm Donna Chow, your host and moderator for today's class. We are excited to be sponsored by Evergreen Herbs, who has been supporting our webinars for over 2 decades, demonstrating their unwavering commitment to provide unmatched quality and service. Today, we present the first part of the highly anticipated class, Unexplained Infertility, Treatment with Acupuncture and Chinese Medicine, featuring the esteemed Dr. Kim De La Cruz. Dr. Kim has over 19 years of clinical experience in San Diego, California, and is nationally certified as a licensed acupuncturist and Chinese herbalist. She specializes in orthopedics and pain management, women's health and fertility, and pediatrics. TCM has been widely recognized for its effectiveness and non-invasive nature in treating infertility for centuries. We have had the pleasure of hosting distinguished doctors, including Dr. Robert Chu, Jimmy Chang, Peter Kington, and Michelle Marimore, who have shared their expertise on infertility treatment in their clinic during our webinars. I'll share the link to their classes in the chat room for your reference. Today, we are thrilled to have Dr. Kim De La Cruz join us for her very first weekend webinar to share her invaluable knowledge on infertility treatments with acupuncture and Chinese medicine. We look forward to an informative and insightful session with her. Please note that this class is divided into 2 parts, with part 2 scheduled for tomorrow. To attend the full class, you'll need to be able to take both parts since there is a lot of valuable information to cover. We'll be running the class from 9 to 6 p.m. Pacific time with 4 breaks scheduled, and lunch is 1 to 2 p.m. Before we get started, can you guys do me a favor and set your chat preference to everyone so that all attendees can see your messages and join in on the conversation? If you do have questions for our speaker, please type them directly into the Q&A box, and questions only. If you have any comments or anything, please direct that to the chat room. And then after the webinar, a quiz will be available the following working day, and we'll send you an email notification once that's ready. So let's go ahead and dive in. Dr. Kim, the floor is yours. Will you go ahead and share your screen and your PowerPoint and take over from here?
All right, let me share my screen. So I do screen. Hold on a second. Let me get my PowerPoint up. Sorry. Hold on a sec. Ooh. Here we go. Okay. Okay, now I have to do full screen. Hmm. How do I do the full screen?
Oh, it's gonna be on the slideshows.
Oh yeah, slideshow.
Do you see that? Yeah, slideshow, and then you do the slide for the beginning.
Where is the slideshow on the
On
toolbar?
the top, on the PowerPoint, do you see it there?
Oh yeah, there we go.
Right there. And then we can do from the beginning.
Oh, that's right. Sorry.
Okay.
There we go.
All right. We see the full screen now. Perfect.
Okay, let me put this toolbar in the bottom. How do I move this guy? Hmm. 1 second. Here we go. All right.
Okay.
So hi, I'm Kim Dela Cruz. Sorry for that. Today we're going to be sharing Western medicine.
Oh, Kim, is it the bottom of the menu bar showing up? Are you able to move that around, or just like gonna be like that?
Yeah, where do I put that? The toolbar?
Let me see. Can you event the slide PowerPoint and see it go away?
Hmm. No, it doesn't go away. That's why I was
It'll
like,
go away. It's okay. We can leave it. That's fine. We can see the full PowerPoint. That
yeah.
work.
I was wondering why it wouldn't go away. Like oh, my toolbar. Hmm. Yeah, I don't know. It's not going away. Interesting. Let me see. Oh. Is that okay?
That'll be fine.
Oh, how do I go back? How come it's not letting me? I'm just going ahead.
Oh, just keep, the PowerPoint just keep moving.
Well, I'm clicking and it's going forward. I want to go back to the beginning.
The other key, other arrow key to on your keyboard or the mouse.
Oh, I see. Here we go.
You can do that.
Okay, here we go. Sorry. Oh boy. No, this is going to be from the beginning. Let's go back. Okay, sorry everyone. Kim Dela Cruz, technical difficulties. Can everybody see the full screen? Or is there things in the that are in the way? Because I
You
see
still
my
see the yours the test bar. Let's see. We
yeah,
can.
my taskbar. How do I get rid of
Okay,
it?
let me walk you through this really quick. All right, so what we're gonna do is let me go and do this very quick. We're gonna auto hide them. So oops.
Sorry, everybody. I don't know how to get rid of the taskbar.
Okay, okay, Kim.
Yeah,
When you on the move your mouse toward the test bar
yeah.
and a right click.
My taskbar or the Zoom taskbar?
Oh, your test bar.
Oh, yeah. Right.
Click. Yeah, that maybe on the somewhere on the bar, make a right click and give you the option. Yeah, so the test bar settings. Go ahead and open it up. Yeah. So we're
Okay.
gonna hide it. So what we do is scroll down a little bit.
Yeah.
Scroll
Hi.
down a little bit, and then where you see the taskbar behavior. Okay. From there, you see the automatic hide this taskbar. Go ahead and click on that for me. And
Okay.
then, so then you close that window.
Sorry.
So wait a little bit, and it should go away.
Okay. Everyone can see my taskbar.
So sure, I don't know. Let's go
Not
away
good.
now.
Not going away. Hmm.
Okay, go ahead and click on the PowerPoint and see is it go away. Go move the PowerPoint.
No,
No?
my taskbar.
Can you go and check the taskbar again? See, make sure the setting that we just did, make sure it's kept.
Taskbar setting.
Let's see the
Taskbar behavior.
Let me see.
Hide, automatically hide the taskbar. Yeah.
Yeah, share open.
Yep.
That should go away. Let me see.
I don't know why it's not going away. Share any window from my taskbar.
We could leave it. That's for now. That's okay. We can
I
still see
know.
the full screen of PowerPoint.
Okay. Let me go back to the beginning. Now you know what I don't see is the taskbar for the Zoom. So like I can't see the chat or that. How interesting.
Could be from the top. Yeah, when do you see in the top?
Oh, I don't know. Now I can't even get out to the, oh, there it is in the beginning. I think what it was doing was hiding the Zoom taskbar.
So right now you don't see the Zoom taskbar anymore?
No, I don't see the Zoom taskbar where all the menu is for the.
It should be on the top of the screen. Can you move your mouse up?
No, it's not up there. I put it on the bottom. Interesting. Okay, I'm gonna put it at the top. Okay, there we go. Are we gonna keep my taskbar down there?
Yeah, that's fine.
It's fine. Okay. Go back to the beginning. All right. Hi, everyone. Sorry for those technical difficulty. We'll probably be seeing my taskbar here for the whole thing, unless it goes away by itself. My name is Kim Dela Cruz. I live in and practice in San Diego, California. I've been working with fertility and women's health my whole career. So since day one, even in the clinic as an intern at school, I worked with fertility. And I think because it's been near and dear to my heart for so many years, working with women in their fertility journey, it's most of the time all acupuncturists, they feel stressed out when they work with fertility patients, to be honest. And that for good reason, because fertility patients are stressed out. But because I am a mom and I appreciate being a mom and I love being a mom, I love being pregnant and having children. And, you know, that was like my number one wonderful thing in the world, that I feel that women go through this journey where, you know, they decide maybe they want to be a mom too. And when they have difficulties, it can be very discouraging. So I really feel happy to help them on their journey and also to help my peers, you guys, to help your patients on their journey. One of the things that I realized starting my career with fertility and women's health was there wasn't a lot of support on the Western medicine side for us to integrate with their Western medicine provider. So reproductive endocrinology and their OBGYN. It was sort of new for acupuncturists 20 years ago. I did a few IVF embryo transfers in the office for with their reproductive endocrinologist, but it wasn't super popular. Now it's really popular. So I think the last time I went to an IVF clinic, there were like 2 other acupuncturists there for their patients. So that it was kind of interesting. It was neat because we were all chatting and, where everyone was from. And so today we're going to talk about the background, a little bit of Western medicine, because I feel integrating Chinese medicine and Western medicine is important in fertility, and to know terminology and to be able to talk with your patients about their schedules for fertility, or, the issues that they're going through, whether it be, endometriosis or PCOS, and to know that their Western doctor is treating them as well as us. So let's go into my background a little bit. I'm just going to acknowledge my teachers, Master Dong, who is the creator of the Dong system, the acupuncture system, which is something we don't learn at the master's level. I don't feel like we learn it. I didn't learn it in school until later, taking seminars, and it's a fabulous system. It's a wonderful distal needling system that I think is better than TCM. I think I started doing the Master Dong system probably about 5 years ago, and I haven't stopped doing that. So when I found out that this system works really well, then I started just doing this system with my patients. And my teacher, Robert Chu, who is my mentor for Master Dong, but I am also grateful to all my teachers in Chinese medicine that has helped me along the way to bring this knowledge to my patients and to you, my peers. So I feel like in this medicine, as educators, we're transmitting knowledge from our teachers. And, things that I do in clinic, they might be new to you, but they're not new to everyone, because some people do the same thing or they do variations of different things. And I'll be presenting the Chinese medicine tomorrow, and you'll see the strategies that we do, that I do, that are a little bit different than maybe other people do. But we want to help, our patients ultimately the best way possible for them to get through their journey in fertility health. Let me see where So the question for today is, what is health? Well, most of the time, it's feeling no pain and not being physically ill, not having chronic illness or any acute pain or illness. So you wake up in the morning. I asked my son one time, my older son, I said, well, what is health? And he said, well, when you wake up and you can move your body and you can go about your day and do the things that you need to do and enjoy your life. And I think that's true. I think that's true at any stage of your life, whether you are a young person or an middle age or an older person. You don't want to feel pain and you don't want to have chronic illness. So health for most people, Western medicine and Chinese medicine, is no pain and no illness. Here, this is a wonderful quote from the Huangdi Neijing. Health is in the highest antiquity. There were true men, Zhenren, who upheld the patterns of heaven and earth and grasped yin and yang. They exhaled and inhaled essence qi, which is Jing qi, stood alone and guarded their spirit, shen, and their muscles and flesh were like one. And thus they were able to achieve longevity in correspondence with heaven and earth. So longevity is also a sign of health. It could be, I think, for this day and age, a lot of people want to live as long as possible, live a life as vital as they can. So what is medicine then? If we know what health is, and, at the times where we, find we're not feeling well or in pain, we look for medicine. So for the most part, medicine is a substance or a treatment that is natural or chemical that addresses pain and discomfort or unease. It reduces it or eradicates it. I'm going to give you a little bit of background for this first part of the talk. We're going to talk about, the basis for medicine, which is philosophy. According to Zhang Shichun, one of the leading reformers of Chinese medicine in the early 20th century, many recent medical journals report take the view that traditional Chinese philosophy holds back the progress of medicine. But their authors do not understand the use of philosophy, nor do they understand that philosophy is actually the basis of medicine. And as we go further, you'll see, well, Western medicine has a different philosophy of how to treat illness and injury, and Chinese medicine has a different way to treat. So, we both work together differently, but as we move on, you'll see the basis of Chinese medicine is philosophy, and Western medicine, different ways to see the world and healing and health. So I found this nice quote also from that author Zhang Shichun, who lived from 1860 to 1933. So that was kind of turn of the century. It is by means of the principles of philosophy that we are able to preserve our bodies by transforming our qi. Taking medicine is the way to protect other people's bodies. It is by first completely understanding the transformation of qi in one's own person, that of the physician. It is able to represent to others how to adjust and transform their qi in their own bodies. That shows our patients that they can transform their qi in their bodies. From this, we understand that philosophy is the true source of medicine, or rather, medicine is a natural outcome of philosophy. And this is why the Huangdi Neijing states explicitly that the study of medicine must start from philosophy. So Huangdi Neijing, if everyone knows what the Huangdi Neijing is sort of our Bible for Chinese medicine. So most of us have read it, part of it in school. They talk about it. So we'll talk about the classic text too, where we can get information to know where our medicine comes from, because it's important that you know classical texts so you know why we treat the way we do. So we'll start with some history. Shang Dynasty is also known as the Yin Dynasty. And it was responsible for bringing into culture the ancestor worship, the I Ching, which is the divination, and sacrifice. So they cracked turtle carapaces or ox scapulas, and they answered questions on the bones. And then they used the lunar cycles, and they also introduced the 10 stems and 12 branches, which is the Ganjur. The Shang religion was highly bureaucratic and meticulous and ordered. So oracle bones contained descriptions and dates and the rituals of whoever the person was they were asking about, their ancestors, and questions associated with the divination. So in this way, Shang Dynasty was sort of like ancestor worship, and this type of philosophy was the basis of their medicine. Let's go forward. Oh yeah, I don't have the I Ching was a divination manual in the Western Zhou period, and it became part of the 5 classics in the 2nd century. So the 5 classics are these books that form part of the traditional Confucian canon. Talk about Confucianism because a lot of our medicine was based out of the Confucian period, and books that were translated or came about to be, compiled were during that time. So together with the 4 books, which included the Analects and the 5 classics, which were mandatory study for Confucian scholars and government officials, and sometimes military officers. So if you were a learned person back in the Western Zhou period, you would study, these were for the literati and for medicine too. I think, doctors at that time started to become part of the literati. And there were still some people out in the countryside practicing medicine, but the 4 books and the 5 classics were the basis of the Confucian period. So let's go to the next slide. The 5 classics were the classic of poetry, the book of documents, the book of rites, the I Ching, and the spring and autumn annals. So let me go to what they were. The classic of poetry was a collection of 305 poems divided into 160 folk songs. And they were sung at court ceremonies, and there were hymns and eulogies sung at sacrifices to heroes and ancestral spirits of the royal house. So that was memorized. All of these were memorized by the people who needed to memorize them because it was part of their schooling. The Book of Documents is a collection of documents and speeches alleged to have been written by rulers and officials of the early Zhou period. It is probably the oldest Chinese narrative, and they probably date back to 6th century BC. The Book of Rites was describing ancient rites, social forms, and court ceremonies. The version that's studied today is reworked and compiled, and it has said to be edited by Confucius himself. So the Book of Rites. The Book of Changes, or the I Ching, was a book of divination that was comparable to Western geomancy or the West African Ifa system. And it's still widely used today. I use the I Ching, and I do I Ching acupuncture. So it's still used, and it's still very relevant today in our medicine. And the Spring and Autumn Annals, which are a historical record of the state of Lu, Confucius' native state. So it also has been attributed to have been written by Confucius. So they had to memorize all these things. And there was a thing that I read about when a child went to school, I don't know what year this was, by the age of 5, they had already memorized the classic of poetry. I think they were quizzed. So they would know, basic stuff about Confucianism and their work, so that that's how they lived in society. Confucianism was. So then let's move on. Next slide. A little bit more about history before we move on to the Western medicine today. In the Ming and Qing dynasties, the 4 books and 5 classics were the subjects of mandatory study by Confucian scholars who wished to take imperial exams and needed to pass them in order to become government officials. So any political discussion was full of reference to this background. And one could not be one of the literati without having memorized them. So yeah, they memorized them. And that is amazing because, what do we memorize now? We always look up books. We have references to things. We have, the internet. But back then, there weren't a bunch of these books floating around. There was not the internet. They just memorized it and they had it. And that was their, I don't think I would want to be taking a test about the 5 classics right now. I don't think I would pass. All right, so let's move on. All right, stems and branches, or the Ganzhi, the sexagenary cycle, also known as stems and branches, is a cycle of 60 terms, each corresponding to 1 year. Thus, a total of 60 years for one cycle. And historically, this was used for recording time in China. So a lot of time and cycles and seasons, all very important with Chinese philosophy and Chinese thought because of, they even now they say, well, history repeats itself. Well, 60-year cycle is the repetition. So they, instead of like a circle, instead of a linear timeline, it's like a circle. So a spiral. Next. This one is kind of blurry, but this is sort of like a little bit of how the stems and branches correspond to Chinese astrology. So you'll see the earthly branches correspond to each of the Chinese animals in Chinese astrology. So in our medicine too, we have cycles that help us with medicine. So let's move on. In the Neijing, it is maintained that man corresponds to heaven and earth, both natural phenomena in the universe and energy circulation in the human body can be calculated by reference to the pattern of stems and branches, with stems representing heaven and branches representing earth. And so the cyclical nature of health also in our body and in the world outside of us with, the seasons. There is a research paper I saw that's just recent, January 2021, where acupuncture treating heart disease based on the 60 jiazi, which is the stems and branches, and the 8 palaces. Mathematical reasoning of treatment principle based on yin, yang, wu, xing, which is 5-element theory in traditional Chinese medicine. So this interesting article talked about treatment of heart diseases with the cyclical and seasonal system of Chinese medicine. A nice little picture that shows the trigrams in I Ching, stems and branches. Yeah, let's move on. Oops. Okay. The Western Zhou dynasty, the first half of the Zhou dynasty, 1045 to 771 BC, they talked about the mandate of heaven. So if a ruler was not doing well, an official, someone in charge, they would change him or get rid of him because he was not getting the right information from heaven. It went from heaven to the ruler to the people. And so if the people were not happy, that means the ruler wasn't doing well. So that means that heaven, didn't agree with the ruler. So that came about in this period too. Sort of like how they did kings, in the Western world. Also in the Western Zhou period, they did solar terms. Solar terms are jieqi. So solar terms is also a calendar. I think this one is 24 periods. They talk about the seasons, how the seasons change and that climate, and it governs agricultural arrangements. So planting schedules, when it's cold, when it's rainy, when it's warm. And it functions even now. We still use the jieqi. So each solar term has about 15 days, and it's decided by the position of the sun. So there's the lunar calendar, which I think is more with stems and branches, the ganja, and then there's the solar, which is more of the jieqi. I think that's how I see we use both in Chinese medicine. Now here's the solar terms in the Shang dynasty, early, they did 4 solar terms, which was the spring equinox, the summer equinox, the autumn equinox, and the winter solstice. And they observed shadows, when the shadows were the shortest or the longest, or when the shadows were moderate. By the Zhou dynasty, they had 8 solar terms, and by 104 BC, they used astronomy to determine the 24 solar terms. So that's a long time ago, and when we still use it today. But, the weather has changed for sure. I'm pretty sure it's changed since back then, but you kind of see how the weather patterns change, every 15 days. And if you pay attention, it kind of brings about allergies during the spring, or, more colds and flus during the winter time because it's cold, or maybe stomach issues in the summertime when you have dampness and you're eating, too much barbecue or something like that. All right, seasons and cycles were important in Chinese medicine for diagnosis and treatment. We have the Wu Xing, which is the 5-element cycle, the 5 phases, or the 5 transport cycles. So you have, those 5 points on the 5-element chart that we have to memorize for boards, that are the element points: fire, earth, metal, water, wood. And each of those are corresponding to wellspring, stream, river, sea, which in an agrarian society and farming makes a lot of sense, because the way the water moves outside is similar to the way the water would move inside our body. So you have the macrocosm outside of us, and you have the microcosm, the health of the land and the health of the people. It's very reflective. So there's a nice little, blue background 5-element chart that we also have to memorize. So with anything with Chinese medicine, when you start to diagnose, just a little aside, sometimes when I talk with people, like other students or other practitioners, and they're having difficulty, with patients, I'll ask, what is it? Is it yin or yang? Is it hot or cold? Is what element, what organ channel, what element is it? It's very simple and very basic, and that will never leave. That will always be the basis of our medicine. And if you just stick with these kind of basic, rules and thoughts from ancient philosophy, this is how we run our show. It's not, we do have complicated cases, but if we're basing our medicine on symptoms and what is acute first, and then chronic or basic foundation stuff, it can be very simple to treat, as you'll see for tomorrow. Oh yeah, another season and cycle that we use in Chinese medicine is the Zuwu Liuju, which is the chronoacupuncture, which is the clock. We have the times for each organ that is active. So this theory was first written down by He Ruoyu, later annotated by Yan Mingguan in the 12th century. So a long time ago. The natural phenomena, such as the movements of celestial bodies like the sun and the moon, and the arrival and departure of seasons, the beginning and end of the day, and the ebb and flow of the tides. So a lot of has to do with the seasons and cycles for health. So here's a lovely, clock here that shows Zuwu Liuju, the elements and what organs are active during that time. And there are acupuncturists that do like to treat issues during that time. If someone were to come in like at 11 o'clock, here, it's a heart channel. So maybe they haven't eaten yet or something like that, and they're probably feeling kind of low. So maybe people would treat that, or they would find correlation in the pulse that would show that there was, weakness in the heart channel or something. Yeah, that would make me sad if I hadn't eaten yet and I had to go to acupuncture. So always eat before acupuncture. All right, a little bit more history and politics before we dive into some Western medicine stuff. So the Zhou came to believe a person could earn heaven's reward by acting in a virtuous manner, and could thereby control his destiny. Around 500 BC, after the Zhou state was weakened and China moved into the spring and autumn period, the classic period of Chinese philosophy began. And so this is known as the 100 schools of thought, 6th to the 3rd century. This is considered the golden age of Chinese philosophy. Of the many schools founded at this time and during the subsequent warring states, 475 to 221 BC, the 4 most influential ones were Confucianism, Taoism, Mohism, and legalism. So for us, Confucianism and Taoism are sort of the basic, that's where our a lot of our books and our Chinese medicine started to stem from. You have the 5-element stuff that are taught and written in books with Taoism. the five wuxing, you have yin and yang, you have the zong fu, and these are all listed in the Huangdi Neijing, which was written and compiled 2,200 years ago during the Warring States period, 475 to 221. So that was the golden age of Chinese philosophy when the Huangdi Neijing was written or compiled. And I included a website that shows the top 10 classics of Chinese medicine, so you guys can all peruse through and see how, where our medicine comes from. So this is a nice picture, Huangdi Neijing. And let me move. So I'm going to talk about the four. There's four that I was taught that we should have a basic grasp of knowledge for. The ABCs of classical acupuncture and moxibustion, which is the Zhenju Jia Yi Jing. This is the 12-volume book written by Huang Fumi and is the first monograph on acupuncture and moxibustion. So, most of the time, I think in school, maybe a couple of teachers talked about the classics, but for the most part, it was all memorizing, CAM and maybe Shanghai text, for test taking, which is kind of sad because now after school, we take all these classes now and we're learning even more about our medicine, which is exciting because I love our medicine, but also confusing because maybe people are, we're not given a good foundation for, treating their patients. The basic, the Nanjing, which is the difficult classic or classic of questioning. The Classic of Difficult Issues, which is a book which appeared in the 1st and 2nd century BC or earlier. The authorship was unknown, although it was often ascribed to Qin Yu Ren. It deals with fundamental theories and expounds main points of the Huangdi Neijing in the form of questions and answers. The Zhenju Da Cheng, which is a collection of 10 volumes of writings on acupuncture and moxibustion. It was compiled by the Ming Dynasty by physician Yang Jizhou, 1522 to 1620. First published in 1601. And then the Ling Shu of the Huangdi Neijing, which is an ancient Chinese medical text whose earliest version was probably compiled in the 1st century BC. It's the oldest technical manual in acupuncture. It's attributed to Huangdi, which is the semi-mythical first emperor of China, who reigned from 2697 BC to 2597. So, when they talk about our medicine being like, thousands of years old, here's the proof. This is where we get our medicine from. We get it from thousands of years ago, and we still practice this medicine, which is wonderful. However, it is likely this manuscript was actually written during the Warring States, which is still a long time ago, on the basis of earlier text. Also goes over the importance of 9 needles and the techniques that are associated with 9 needles, which is like the ancient way that they used to practice. Everyone had 9 needles, different types of looking needles, and that's their little toolkit. They just used them over and over again. There were no disposable needles that were, sterilized, single use, sharps container. They just went and there's that movie, I think it was something about your name on Netflix, but he was an acupuncturist and he would sharpen his needles on a rock in the river, keep reusing his needles on everyone. He would use one needle. Pretty cool movie. All right, this is a nice picture. I like this picture because I can't read everything on it, but I can see the trigrams. So there's heaven is up at the head, and you've got fire on the right and lake on the left, and you've got earth on the bottom. And then I can't see any other trigrams on this one, but maybe somebody can mention something to me about this picture. It's pretty cool. All right, we are done with this section. Let's move on. My background. So that's my little history lesson, Chinese philosophy, Chinese history. My background, so now my history. I have a bachelor's of science in biochemistry and pre-medicine I was going to go to medical school, but that didn't happen. I have a minor in philosophy, so I loved philosophy so much in college. I took a lot of classes and I just kept taking them until I said, oh, I think I have a minor. So I got one. And maybe that was something that helped me, formulate, this talk, was because, I really like the Chinese philosophy in our medicine. So that's one of the draws to me for that. I did public health graduate studies. I didn't finish because I was doing a different style of public health. I was doing environmental health science, and it was really boring. Lots of legal documents. So not for me. I got my master's of science in traditional Oriental medicine from PCOM at that time. So that's Peaches now, Pacific Center of Health Sciences, I think, in San Diego. That was in 2002. I just got my doctorate last year. I did the bridge transition doctorate for 5 branches, which was wonderful, a wonderful program, and asynchronous, all online, and heavy on the case studies and integrative medicine. So that was a great program. I did do the NCCAOM tests in school so that I could keep that current if there was any, if by chance I moved to another state, but I've been in California since the beginning. And I'm a certified yoga teacher, and I've practiced yoga for 33 years, since I was 18, and now I'm going to be 52. So, whoa. Yeah, so I think my background has helped me kind of compile all this data today, because I really like research and Western medicine. So because I come from a Western medicine background, I worked in research and biochemistry in a lab for probably almost 10 years before I truly transitioned and just started doing Chinese medicine. I was kind of like half and half, well, full-time, laboratory person, and then part-time acupuncturist for a long time. So I like seeing studies, I like seeing research that supports our medicine, and I also like to integrate Western medicine with ours. And I really feel that at a higher level, we should be educating students of Chinese medicine more heavily with Western medicine, because we'll see more integrative medicine more and more in the future. And probably, my feeling is maybe MDs will start to want to train Chinese medicine too, because it's beneficial for their patients. My training, for the most part, at the beginning of school and a few years into my practice, I did Japanese acupuncture and Kampo. My teachers were Casey Conover, Elizabeth Talcott, and Shinjiro Kanazawa. They were all at PCOM, and they were all wonderful, and they were all students. I don't know about Shinjiro, but Casey and Elizabeth were students of Ikeda Sensei, and they were always in Japan, and they would bring them, back their knowledge, and we would benefit from all this good stuff with acupuncture. And I really feel with acupuncture and palpatory skills, the Japanese really focused a lot on that more than the herbs. Most of my Chinese medicine teachers mostly focused on herbs, because in China, it was a lot of herbal medicine. So I learned mostly herbal medicine from my Chinese medicine physicians, and then I learned mostly acupuncture from the Japanese tradition of acupuncture and meridian therapy. Kiko Matsumoto has been a big influence on me and her style of practice. I still use her stuff in practice along with Master Dong, which I think works really well. The Dr. Mukaino, who I met a few years ago, who does the M test for orthopedics, very, very effective system to treat orthopedic pain, like 1 needle, 2 needles, and really, really effective. So if you ever have a chance to train with Dr. Mukaino, that would be very beneficial to your practice. The Toyohari, I did train with the Toyohari abdominal palpation. That was, those are the practitioners that are blind, and they hone their palpatory skills. Very, very much so. Palpatory skills more important with acupuncture. So if you're not palpating the body in practice and not feeling the pulse, you're not feeling the channel, it would be hard pressed to know, where to put the needle. I mean, we do have our measurements and things, but you need to palpate to feel the active point. I trained with pediatrics who I love treating kids in my practice, and I thought I was going to be a pediatrician, like to treat kids on the Western medicine side because I love kids so much. So instead I trained with Chinese medicine, and I had wonderful teachers, Alex DeBerry and Kano Sensei from Japan, to treat kids without needles. So mostly Shonishin and Teishin. I trained with orthopedic acupuncture with Matt Callison, who was a wonderful teacher. He was my teacher at PCOM also. Deeper needling, muscle, involvement. If that's what's required for my patients, I'll do that. And then, of course, Master Dong acupuncture, which is my main way that I treat in clinic. And that was with Robert Chu. That's who I trained with Master Dong, with I Ching acupuncture, with chrono acupuncture, and with optimal acupuncture. So all these things are fairly new. I don't think many people know how to practice these last ones because they're not really taught in school. We don't talk about them much in like CEUs and stuff. So not a lot of people seek out this type of training. And then also my fertility acupuncture and Chinese medicine, I had many teachers and also mentors. So working with, Kristen Burris, I'm going to mention people, who was my first fertility practice, working with her practice. I kind of skipped around from fertility to orthopedic, depending on whose office I was working in. But I learned a lot about fertility with previous practices I've worked with and classes and teachers that I've studied with. I do a combo plate of many things that people have taught me. So that's what I'm going to teach you for this weekend. So today, we'll just describe what we're going to talk about for this 2-day seminar. This 2-day presentation of Unexplained Infertility is 2 parts. Today, we'll discuss the Western medicine. We did a little bit of history, which was nice, so that you understand where Chinese medicine comes from. But then we'll go into the Western medicine for the most of this day, and then we'll circle back to Chinese medicine towards the end of the day. Today, we'll talk about Western medicine diagnosis, how they view infertility and treatments. And then a little bit at the end, we'll come back around to Chinese medicine and how we see infertility and how we diagnose. If we have time, maybe we'll go into a little bit more discussion about how Chinese medicine sees unexplained infertility. That'll be a good segue for tomorrow, which tomorrow will be a review of 15 conditions that may be the cause of unexplained infertility diagnosis. So you'll see some Western medicine terms tomorrow because I'll cross over back and forth Western medicine to Chinese medicine. And we'll see tomorrow also treatment with acupuncture and some herbal formulas. So my observation that I've seen, since patients will come and they'll have their Western doctors, requirements and treatments, and then they'll come for acupuncture to help. There is a difference with treatment strategies and protocols. They want the patients to be regulated with hormones and to have a schedule. And I think on our side, we want our patients to feel at ease and harmonize their body so that they're receptive to whatever treatments they're getting from their Western doctors. So, they're feeling fatigued because they're getting injections of Lupron, or they're getting high estrogen patches, they're going to be sleepy, and you're going to want to have to maybe boost their chi so that they can actually get rest. So I think both sides work well together. So if you're actively treating fertility, people who are on a schedule for IVF specifically, you'll see that acupuncture works very, very well together. So that's a big difference. The other thing is, there really is only 2 treatments with Western medicine, 2 treatment strategies with Western medicine, 2. So it's either drugs. So the Western drugs, so hormones, they're going to put you on hormones to either mature your follicles, your egg follicles, or, decrease your testosterone or increase your estrogen or suppress your menstrual cycle, because they want to control you a little bit for fertility so that they have a better success rate of, getting your body to produce the, eggs and get fertilized. So that's all done with drugs and hormones. And then they've got the IUI and the IVF, which is intrauterine. So they're taking cells and putting them back. So they're taking cells out of your body and then putting them back. So this is the Western treatment. So hormones or drugs, and then taking cells out of your body and putting it back. Very, very Western medicine. Now, Chinese medicine, we got a lot of different things going on. So that, to me, is the biggest difference. We're not really interfering or taking things out and putting things in. We are harmonizing. We're harmonizing, we're balancing, we're reducing symptoms that are uncomfortable. Pain, discomfort, fatigue, bleeding. There's a lot to be said. And really what we're doing is we respect the patient's body. If I feel that my patient is, being pulled every which way by their Western doctor, I almost want them to take a break seeking treatment with me a little, because it's almost too much. Because maybe they want to just focus. I've had people text me or email that said they wanted to skip their acupuncture because they just wanted to rest. And that's, to rest, meaning, psychologically rest, because you get pulled in all these different ways, to try to get pregnant, and it's overwhelming sometimes. So just be respectful of your patients and their, mental and emotional state. And that's another reason why this medicine is so hard for us to treat fertility, because it's, because our patients are emotional and they get mad and they might, lash out at you, or it's not your fault. But, as you stay present in the present moment, you'll understand that, that there is, things move and change, and, patients will get better, and they'll not feel as, upset or cranky, and they'll get better. So I heard this thing yesterday, and I keep sharing it with people, is that it's not like something bad happened to you and you're ill or you're having an illness. It's like you're actively healing. You're actively healing. You're actively moving. Your body is always moving. All right, section concluding. Where are we? All right, moving along. Here's a nice cartoon here. I don't know if I should check the chat to make sure. I'll check the chat in a little bit. I want to get through this a little bit more, because maybe right before the break, I think our break is at 10:45. Maybe like at 10:40, I'll check the chat and address some of the questions that are in the chat, if there are any. So this cartoon is funny. It says, a doctor will be in shortly to type on the computer and update your chart. And if he has time, he will ask you how you're feeling and take a look at your rash. So also Western medicine, you go to the doctor, you wait for 20 minutes, maybe longer, and then they barely look at you. They're typing on their chart, or they're entering your information, make sure everything's correct in the computer, that they tick the boxes and say, yeah, he's here or she's here and I'm treating them, and here's the chart notes. And maybe their chart notes are like 3 things, high blood pressure, your pulse, your weight, what you're there for, if they address that problem. So if you go for, a checkup, they're only going to see you for a checkup, and then you're gone in 10 minutes, then they'll take they'll say another appointment, another visit. So it's hard to get addressed, your conditions addressed in the Western medicine, unless you really have your questions down. So when you go to your doctor and you have a game plan, you make sure you write down all your questions and you ask them everything, because they want you in and out as quick as possible. And this is why I put the cartoon up, versus us, who really take some time to listen and understand what we're dealing with, and our diagnostic skills take a little bit longer. As we listen, I listen usually. If I'm, going at a faster rate for my clinic, I I will take the pulse and look at the tongue and palpate while they're talking. So, so it's a little bit faster, but I'm still getting all this information versus, typing on a computer and not looking at my patient, not seeing what they look like, not feeling if they're feeling bad today, or, if they're sweaty or whatever, if they just, anxiety. So that's, another difference between us two. Okay. So what is unexplained infertility? Unexplained infertility is when fertility testing hasn't found a cause to explain a person or a couple's infertility. So they do all these tests, they check everything, and they don't find anything that's wrong with you. I mean, wrong with you. Who knows what they can see? The term unexplained infertility really reflects the present limitations of medical science. The fact is that current technologies do not have the tools for revealing the cause of infertility. So Western medicine, again, deconstruction view is, what is the cause? That way we can fix it. What is the cause? Versus Chinese medicine is not really what the cause is. What are you feeling right now? What are you feeling right now? And how can we move that forward? So instead of going backwards, like Western medicine, finding the cause and fixing it, we see health as a moving river. Things happen, leaves fall into the river. There's a rock over there. The river's flowing faster. It rained over there. So we see the body moving forward, and we treat this way. Western medicine, not so much. Have very few tools, and we'll go over the tools today, what they do to narrow down whether you have infertility and what it's from. So that's what we'll do. And some of your patients that will come in, they'll talk about their blood tests, they'll talk about their exams, and they'll give you values, and you can look at their labs. And this is one of the things that I really appreciate about being able to present today was when I was seeing patients in clinic, I never really asked for labs or looked at their test results because I didn't really understand. All I knew was how to treat them from the Chinese medicine perspective. But now as I go, I've been practicing for a while and seeing patients, I've become much more comfortable with looking at labs and understanding what they're going through, because it's important that actually. I think it's very important, specifically for fertility, that what they're going through, because there's a lot. It's a lot. And you'll see later on, I posted a calendar to show what the schedule looks like for a typical IVF. And it's wild. And then they're seeing you. So, hopefully helpful, and hopefully not as stressful as them seeing their other doctor. Yeah, I think that's all I want to say for that. What is unexplained infertility? People diagnosed with unexplained infertility have been trying to get pregnant for at least a year if they're under 35, or 6 months if they're over 35. So at that time, the doctor may start, or, you go to the OBGYN first, and then they might check blood tests. But for the most part, if you haven't been able to get pregnant for a year, they will refer you to a reproductive endocrinologist, and then you will get all your tests done, and they'll find out more. And then it just keeps going on and on from there. If you continue on to try to get pregnant, they will give you their options, which are drugs, hormones, IUI, or IVF. Although a specific therapies for unexplained infertility does not exist, because it's just drugs, IUI and IVF, usually treatment-independent pregnancy occurs in this group of patients. But many individuals pursue treatment anyway. It's a costly option. So you see, I've seen this in clinic too, where someone has gone to a fertility clinic and they've done 3, 4, 5 IUIs, which is intrauterine insemination, which is where they take the sperm and then they place it into the uterus to fertilize the egg. Then those don't work. Then they go to IVF, and maybe they go 2 or 3 or 4 IVFs. and still not pregnant, and then they take a break. So maybe after a year, they find out maybe a year into trying, then they try for a year of like active, IUI and IVF Western medicine. And then the next year they will get pregnant because they were taking a break. It's not that they gave up. It's just that they decided to say, I just want to relax and just have my body back, have all my hormones be normal and relax. I think my most favorite patient who did IUI, she actually was going to Mexico because it was cheaper. She decided not to go anymore. I think it was like her third or fourth IUI. And then I think she got pregnant within like 2 months of me treating her. And I still see her baby. Her baby's like 4 now. I think she's trying to have another baby, but she was around 33, 34. And I feel like all of her labs, I didn't look at her labs at that time, but were probably normal. Everything was normal. So this is what this quote is saying, this slide is about. So you don't know what the actual cause is. And Western medicine doesn't have a treatment for that. They just do IUIs and IVFs. The current rate of unexplained infertility is about 50%. So they can't find a cause. So this slide is saying that they cannot find a cause for infertility in couples where the female partner is under 35. And it's about 80% by the age of 40. So that's pretty high. 50% of all infertility is unexplained infertility. I don't think people can, we'll see further in this talk today, because Western medicine and tests are limited. In reality, there are probably hundreds of causes of infertility. And there are a lot of things that have to happen perfectly in order to get pregnant and have a baby. Lots of things. And I see this at every step of the game, there could be issues. And, Chinese medicine treats that, and we treat it wonderfully and beautifully and with sophistication that, taking hormones and doing IUI and IVF is kind of like the doctor saying, here, take this pain med for the pain. Well, isn't there anything else I can do? No, there's nothing else you can do. I don't know. That's just a little bit limiting. All right, so next section, we're good. Oh yeah, here's a lovely cartoon of what's happening for fertility. You've got your ovaries where your little happy egg follicles are getting ready to go down the fallopian tube. And then you've got your uterus and the ovaries, and you've got your brain and your pituitary, which all the hormones, the regulatory hormones for fertility and reproduction and fertility, egg and sperm health are from the brain. So this actually is what I would call heart and kidney in Chinese medicine. Heart and kidney not communicating is a hormone-based regulatory issue with fertility. So heart and kidney, blood means a lot of things, but coming down and nourishing the uterus, which, is all blood coming down, nourishing the uterus. It means you're bringing all the hormones down with your blood, from the pituitary gland down to the uterus. And then kidneys are, the genetic factors and your adrenals and your energy, your jing, that help with creating a vital environment in your uterus. So you've got, heart and hormones coming down, you've got jing and kidney energy, and, trying to help and make your uterus and your ovaries healthy enough to have a pregnancy. Let's see. So the magic of conception. And it is magic. I always feel like when someone gets pregnant, it's like, whoa, what happened? Where was the magic? But it's, for some reason, I kind of like keeping, that mystery a little intact, because it's like seeing the stars and knowing every constellation in the sky. Do you want to know? Or do you want to kind of keep it sort of that mystery, that magic of, the stars and space? So a little bit like that. I mean, you could get into the nitty gritty. There are people that just want to know every single thing about their hormone cycle and their fertility and their menstrual cycle. And that's wonderful, but it gets a little overwhelming. And I've had patients go, well, I don't want to take my temperature every day for basal body temperature. I don't want to know. I don't want to know when I ovulate. I don't want to have to keep peeing on a stick for ovulation. I don't want to know, I mean, it's like a laboratory at their house because they have all the kit, the tests at home. So it's a little bit overwhelming. And sometimes I think that is, detrimental to getting pregnant, because it's, you end up being like, the mad scientist. Whereas you should just be the magician, right? Not the mad scientist, the magician. So two sides, maybe the same coin. So the magician, the hormones that stimulate egg development must be made in the brain and pituitary and be released properly. So that's a big one. So a lot of times testing done with Western medicine, testing for hormones, which is great. We can see that. That's important for us too, for Chinese medicine too. The egg must be of sufficient quality and be chromosomally normal. Now here, we don't know how they can test egg quality. There's only maybe a couple of tests that can help determine whether your eggs are of good quality. We'll talk about that test later. Chromosomally normal, they don't know unless they take the egg out and watch it divide, under a microscope. They're not going to do that unless you're doing IVF. So then they can see the quality of the egg, maybe after it's frozen and then rethawed, and then if it's dividing properly, so that they can implant the embryo into the uterus. So that's maybe the only time that they can actually check that out, egg quality and chromosomally normal during IVF. The egg must develop to maturity. Yeah, that takes some magic there. That's let's go forward. The brain must release a sufficient surge of the LH hormone, which is luteinizing hormone. I should have wrote that down, to stimulate final maturation of the egg. So before the eggs are released from the ovary and travels down the fallopian tube. Saw my little cartoon back there. They're all happy in there. One of them gets really big, maybe 17 or 25 millimeters, usually just one. And then it goes down, and that's the LH surge, LH hormone stimulation. So that all has to happen from the brain. The follicle egg develops in structures called follicles in the ovaries, must rupture and release the follicular fluid in the egg. So that's ovulation. The tube must pick up the egg. So if you ever seen the ovaries, it's like this catcher's mitt. You've got the ovary, it's got a little circle, then you've got a catcher's mitt. It's not even connected to the ovary, and it's supposed to go down that tube. This is where they have problems like ectopic pregnancy or tissues migrating outside of the reproductive system in women, because it's a catcher's mitt. It's not really connected to the ovary. You've got the ovary all on its own little island, and then you've got the catcher's mitt for the follicular, for the follicle to be caught and go down the fallopian tube. It's a little bit strange. All right, the sperm must survive their brief visit in the vagina to enter the cervical mucus. Could be an inhospitable pH level. Sometimes people have allergies to sperm, so that, that's another problem. They have to swim to the fallopian tube and find the egg. So you've got some millions of sperm swimming up, and one of them has to do it. The sperm must be able to get through the cumulus cells around the egg, bind the shell, zona pellucida of the egg. So that has to happen. The sperm must undergo a biochemical reaction and release DNA into the egg. So here, things could happen here because we have problems with sperm quality. Sperm motility, sperm morphology. We'll go through that later on as one of the tests. The fertilized egg must be able to divide. So you've got the cells starting to divide, 1 to 5 cells, 10 cells. The early embryo must continue to divide and develop normally. After 3 days, the tube should have transported the embryo down into the uterus. So no stopping. Sometimes there's scar tissue in the fallopian tubes and then the egg just stops there. You can't have, that's called a ectopic pregnancy. That usually ectopic pregnancies are found in the, oh, is that our time for a break? Wait, let me finish this slide and then we'll maybe take a break. I think I have it on here, 10:15. After 3 days, the tube should have transported the embryo down into the uterus, and the embryo must continue to develop and expand into a blastocyst. So you hear this a lot in reproductive endocrinology, blastocyst stage. Did your embryo get past day 5? If it got past day 5 and it all looks good, then they do the genetic testing and they get ready to do your transfer. So blastocyst is a big, big milestone for IVF. Let me see what's the next slide. We'll finish up this magic of conception. And then I think we'll take a break. I'm not sure. I think our break is at 10:45. So we'll go to 10:40, and then I'll look at the questions, and then 10:45, I think we're taking a break. I'm pretty sure.
Hello? Okay, guys, if you didn't see the chat, we are going to go ahead and take a break now, and we'll return at 10:35 a.m. Pacific time.
Hi, Kim. Do you want to, on the break, you want to do the quick little fix up the PowerPoint so make sure we don't see your little test bar? We're gonna work on it. Okay. Hold on. Give me a second. Hold on. Give me a second.